Hello, I'm Corbricia Willie, and I will be presenting Tay Sachs Disease today. What is Tay Sachs Disease? Tay Sachs Disease is a rare disorder in which deficiency of the enzyme hexa-A results in excessive accumulation of certain lipids known as gangliosides in the brain and the nerve cells. The abnormal accumulation of gangliosides leads to progressive dysfunction of the central nervous system. Tay Sachs disease is a lysosomal storage disease. There are three types of Tay Sachs disease. One of the types is the infantile Tay Sachs disease. The second one is the juvenile Tay Sachs disease. And the third one is the late onset Tay Sachs disease. In the infantile Tay Sachs disease, it is the most common and the most severe form. The signs and symptoms of Tay Sachs disease in infantile appears around when they are 3 to 6 months of age. The survival is only for a few years. The most common sign and symptom of the infantile Tay Sachs disease is the cherry red spot in the eye and the growth in the head size. And also they are able to sit up or crawl. In juvenile Tay Sachs disease, it is less common. The signs and symptoms begin in the childhood. The survival rate of the juvenile Tay Sachs disease typical appears in the teen years. One of the most common signs and symptoms of the juvenile Tay Sachs disease is the behavioral problems. In late onset Tay Sachs disease, it is rare and less severe. The signs and symptoms begin in late childhood to adulthood. This form of Tay Sachs disease doesn't always impact on the life expectancy. The signs and symptoms that mostly occur in the late Tay Sachs onset disease is the muscle weakness, the clumsiness, the loss of coordination, tremors and muscle spasms, loss of ability to walk, problems speaking and swallowing. Psych disorders can occur as well, and the loss of the mental functioning. The most common Tay Sachs disease signs and symptoms in all of the different forms are the loss of the motor skills, the startle to reaction of loud noises, seizures, vision loss, hearing loss, and even becoming paralyzed. With Tay Sachs disease, the carriers have a 50-50 percentage chance of passing the defective gene. If both parents are carriers of Tay Sachs disease, each child will have a 25% chance of getting Tay Sachs. The diagnosis of Tay Sachs disease is through preconception screening, innate screening, and having eye exams. The treatment for Tay Sachs disease is there is no treatment, but the goal is to support and comfort and give the nutrition that's needed. Tay Sachs affects males and females in equal numbers. Tay Sachs is used to be considered as a prototypical disease of the Jewish people of the Ashkenazi descent. 1 in 250 through 300 of people are affected by Tay Sachs disease.